Gambia participate in non-governmental organization has added the COVID-19 funding into its routine checks for standard financial management, with force reports due to delivered next week. Key among the context of their research, as hinted by the organization executive director, is lack of suitable measures for the country to cope the COVID-19 crisis. Despite the pledge by those entrusted with the funds that every amount will judiciously be used, the young researchers are of the view that not much has been done in the transparency manner. For more details of that in this report.
Outbreak of the COVID-19 compelled the government of the Gambia to immediately commit $500 million to support efforts to contain the spread of the virus. This effort is being supported by the country's private sector, mainly through the Chamber of Commerce. As a result of public desire for transparency, the watchword has been followed the money, a call that had been emphasized even by members of the National Assembly.
The civil society organizations, the media, to put their eyes on these monies and monitor them very well. And I'll also urge even people who are within the spending committees of government to serve as whistleblowers should there be any element of corruption, should there be any element of diversion of funds into other sectors that it is not meant for. These monies are meant to save us.
Gambia Participates, a non-government organization, is due to release a report of finding into management of funds from bilateral and multilateral partners to the government of the Gambia. Under its fellow, the Money Project, the activists have covered aspects of the country's response to the fight against COVID-19. Executive Director of the organizations hinted at Africa that all is not well in terms of money management.
We took the risk, although there is a social distancing regulation that people should stay at home, but we could not. The reason why we can't stay home is because the money that are coming in, we've seen what happened in the Ebola period, how money were embezzled. So we decided to go out and then get our facts right. So the investigation that we are not investigative journalists, but we are an accountability organization that serve as a watchdog to the government to ensure they put their they take the right steps. So we use online tracking and on-site tracking. So we interview stakeholders and then also use technical filming equipments to document what is actually on the ground.
The Minister of Finance announced last week that $21.3 million has landed into the central bank as a rapid credit facility from the International Monetary Fund, while $10 million from the central bank is being arranged for procurement of medical items. What is spent so far? The explanation of the country's Accountant General, Modulamin Ba, include payment for quarantine centers, trainings and allowance for health workers.
In terms of actual expenditure, we spending the $60 million. The $100 million is relating to some procurement that is currently ongoing, is not yet concluded. So therefore it is set aside and not yet paid out. Because that is pending the completion of the procurement process, then the 100 million would be disbursed. But it is released to us as the paymaster, but we have not disbursed it out. So the other areas we have spent the 60 million include allowances for the health workers, travel expenses.
However, the research by Gambia Participates suggests that a lot of money might have gone through a different channel.
So we have been conducting research on the ground, going to different parts of the country to ascertain if actually these identified treatment centers, because there are 12 identified treatment centers in the country, and one of them is Soma Health Facility, Basse, and then that of Bansang. So we visited these health facilities and then we conducted a research, which I think the reports will be out by next week. And then we have discovered a lot of issues that made me believe that the country is ill prepared to respond to this pandemic.
It is in the belief of Gambia Participates that all funds meant for the fight against COVID-19 must be coordinated in a single account to prevent possibilities of institutionalized form of corruption. Reporting for Africa News, I am Amadou Kante.